Hi, and welcome to Rest and Heal's How To video series. Today, our topic is how to survive chemotherapy. And we are very fortunate to be joined by Dr. Deanna Martinez. Dr. Martinez is a New York City based psychiatrist. She specializes in the neuroscience of addiction, and she heads a research team at Columbia University. She received a breast cancer diagnosis several years ago and went through a very challenging course of chemotherapy. And she has a lot of great advice and guidance for women going through the same thing. And it's very good to hear from the perspective of an MD who has gone through this. So, Rest and Heal has curated a chemotherapy gift box with her, and we're excited to talk to her today. So, Deanna, would love for you to join us.
Hello. Thank you for
Hello.
having me. Good to see you.
Good to see you. Thank you for being here. I guess to start, let's just hear a little bit about your diagnosis and the treatment that you went through.
Sure. So I remember it very clearly. One day I was taking a shower and I noticed a lump in my armpit. And normally when people think about breast cancer, you think of like lumps in the breast, but a lump in the armpit is actually a red flag and should always be checked out. And as a physician, I knew immediately that it was worrisome. And I got it checked out immediately as quick as I could. Actually, I had a mammogram that was negative, and I still had the lump biopsied, and it was indeed breast cancer. At the time, I have to say, I think that the surgeon who did the biopsy thought I was crazy, because when he told me it was breast cancer, my reaction was, "Oh, thank God," which isn't what he normally hears. But because it was unclear what it was clear that it was a tumor. When I found out it was breast cancer, I knew two things. I knew that it hadn't gotten very far, and I knew that a lot of research has been done to address breast cancer. So even though it was bad news, in some ways it wasn't as bad as maybe it could have been. But it was definitely, I mean, people who've been diagnosed with cancer, you remember the day very quickly, right? Everything is starting out like this normal day, and the next thing you know, it's just not. And it's a tough process, because you feel fine most of these days when cancer is diagnosed, people often feel okay. It's screening that catches it, and you're going to go through this wormhole of treatment that seems to have no end to it. And that you're going to go from feeling great and taking care of your family and your job and your household to being really, sick for a long time. So it's a tough pathway. Certainly you have to do it to come out the other side. It's hard to take those steps into the hospital and get started on the whole process, but there really is no other option, at least at this point. And so as I went along treatment, I started writing down a lot of the things that worked and didn't work, partly because I couldn't remember anything, and partly because I didn't want to repeat mistakes. But, as a psychiatrist, I was really attuned to a lot of the psychoactive effects of treatment, and tried to keep track of those in order to improve those for, people who came behind me.
And what about on the more physical side of things? I mean, chemo can just be so rough on your body. So how did you take steps to kind of mitigate that?
It's just, any way you look at it, it's just hard. But I did a lot of things. I read up on a lot of things. I have a couple of friends from medical school who are oncologists. And, I did a few things to try and prevent the worst. I mean, one thing I did is I used mouthwash, non-alcohol mouthwash. Actually, it's like it's not so much mouthwash, I guess. It just provides a film. And, I never had mouth sores, but I certainly knew that chemo can definitely cause those. And I really tried to do my best to prevent those. Chemo can be really hard on your skin. I used tons and tons of lotion. I would just splather my feet in lotion and then put old socks on to try and prevent like losing fingernails, because they get very dry and brittle. They turn strange colors, but I never lost them. I tried a lot of different things. One of the key things as a psychiatrist that I realized going through chemo was the need for sleep, and the need for energy, and sleep is key. So one of the key things when people go through chemo is, we all heard of chemo back in the day, and people used to get sort of very nauseous and sick, and there was a lot of illness, and people lost a lot of weight. That doesn't happen so much these days, because most of the time doctors give steroids at the same time as chemo, and the steroids really inhibit that response of feeling like nauseous and having no appetite. And these are not the kind of steroids that people use to build body muscle. That's a different kind of steroid. These are steroids that suppress an adverse reaction to chemo, but they have their own effects. I mean, the advantage is that people aren't, so sick and nauseous and vomiting, but they really have their own effects. I mean, I remember going from, being like sobbing, crying 1 minute to cleaning my closets at 3 o'clock in the morning, because that's what steroids do. They make you 1 minute super depressed, and then the next minute you're a little hypomanic and you really can't sleep. And then as the steroids wore off, I was just flat out exhausted and couldn't get up. So I try to pay attention of ways to like really start with regulating sleep, because as a psychiatrist, I can tell you that's one of the key things for maintaining mental health. And it sounds like a small thing, but it's really not. Like, getting.
Oh no, it's a huge thing. If you don't get a good night's sleep, I can't even imagine. It's hard enough going about your regular day without a good night's sleep.
Right. And with chemo, you just have to, like, I realized I needed a solid 8 hours of sleep, which I never did before. And it really, really made a difference. And so I experimented with a lot of different things. I experimented with, trying to read books before going to bed. Like, you get this advice, like the whole thing, tea and books. And I definitely did that. I often read books I had already read before, because I didn't want to get wrapped up into a story, one. And two, if it was a book that I didn't know, I often forgot, because your memory is bad. And then I felt panic that I couldn't remember. So it was better to just, read things I read before. And the tea, book, low lights, keeping the room cool, all of that worked not on chemo days. When it came to chemo days and a few days afterwards with the steroids, I absolutely had to take sleep medication, or there was no other way around it. And, I discussed these with my doctor. Mm-hmm. She had started me on a medication called olanzapine, which is an antipsychotic, which is often used. And honestly, not only did it like knock me out for hours, it made me feel really just unhappy. And antipsychotics can do that. They can just make you feel very dysphoric and very down. So I immediately went back to her and I was like, I can't take this drug. And she understood. Mm-hmm. And she gave me Ativan instead, which was far better. But as an addiction psychiatrist, I also know that, Ativan or lorazepam, not only can it be habit forming, but you develop tolerance to it pretty quickly. Yeah. And I really didn't want to develop tolerance. So I had this regimen where I would switch out different sleep medications, some of them over the counter, like my good friend Benadryl or Unisom and Ativan. And I would just sort of rotate them in order to not develop tolerance. And, I would try and stop them when I could, and I'd go back to, the tea and books. But honestly, when it came to straight out chemo days with steroids, it was really necessary.
And I know a lot of people, when they're diagnosed with cancer, they're often recommended medical marijuana. And I know that sometimes it's even a bombardment. Oh, you have to try it. It's worked for me, and this has worked for me, and that has worked for me. And I know you have a very sort of strong opinion on this. So just love to hear that for our viewers.
Sure. I mean, I'm an addiction researcher. This is what we do, right? And, and it's true. You can't have a diagnosis of cancer without everybody giving you all different types of THC and CBD products, left and right. And we actually recently published a paper on this, a colleague of mine and I, about medical marijuana use among breast cancer patients. And what we discovered is that it was an anonymous online survey, and we discovered that about 40% of patients are using medical marijuana during active treatment. And this is actually of concern to me, because when you're using these products, and if you're immunocompromised, you really need to know about the safety of your products. And that's a big problem, honestly, with medical marijuana. Mm-hmm. Certainly, if you're getting marijuana in plant form from the street, it's worrisome. It could have salmonella on it. It could have molds. It could have different products on it. There haven't been a lot of reports of this being a problem for patients, but it's certainly a possibility.
And a risk you just don't want to take.
A risk you don't want to take. And honestly, inhaling, that there have been case reports of cancer patients dying from inhaling marijuana because of the pathogens. Certainly oral forms are safer than inhaling things into your lungs. So I try and point that out. Our GI tracts were evolved to handle pathogens. That's what people did, right? We basically ate garbage for centuries. Your lungs just aren't, right? Your lungs, like anything that you inhale, can be much more damaging. And I think it's key to know that when we did our research study, the main reasons that cancer patients were using cannabis were for anxiety, sleep, and pain. And honestly, the data shows fairly clearly that THC is effective for those three things. It can
Mm-hmm.
definitely help with pain, anxiety, and sleep. You can definitely get tolerance as well to THC, just like Ativan. So it's key to be mindful of that tolerance can develop fairly quickly. And then the other thing to know about THC or cannabis for sure is that there have been a couple of recent studies that come out of Israel looking at marijuana use among patients with metastatic disease. So these are patients with advanced forms of cancer, not necessarily breast, different types of cancer, who are taking immunotherapies, which are the drugs that have come across recently that are very effective. And in those studies, those patients did worse. So while we have data showing that people who use medical marijuana during active treatment, like regular chemotherapy or radiation, probably do okay, people who have metastatic and advanced disease should be very aware of these studies because it's not what was expected.
Mm-hmm.
We've all heard that THC and CBD can reduce tumor growth, and there are absolutely studies showing that in animal models. We don't know that that's necessarily the case in humans. And so this data suggests that you need to be careful and be mindful and really let your doctor know about cannabis use.
And it sounds like we just have a lot more research to be done there before it's, something that is widely adopted.
Especially in cancer patients, especially during active chemo treatment when you're immunocompromised, or around surgery, when you may not be able to heal as well. I mean, we don't know that you don't, but we don't know that it doesn't have that impact either. So I would just caution, like certainly, during active treatment, I think it would be best avoided, honestly, just because of the regulation issues.
Um, I'd love to just touch on the more spiritual side of cancer. And when you went through this experience and this sort of journey, like how do you feel like it changed you in any way?
That's a good question. I mean, it was certainly tough. You can't have this diagnosis without thinking about like what's going to happen. And you certainly, I definitely took the time to sort of think long and hard about what do I think happens after death. And I certainly have my own ideas. I talk about some of them in the journal that's in the package. And I I share those because I just found it comforting to me in some way to feel as though on some level my soul will survive and I will somehow be able to know that my kids and my family are okay. Other people have other ideas. Certainly, I think preparing for it is important. I also talk a lot about the feeling guilty over being moved into survivorship. When I saw my doctor recently, she moved me into survivorship, which is a great feeling. But at the same time, you think of all the people that you sat with in the waiting room that aren't there,
Yeah.
or friends that I made, and all I can say, which is very true, is before being diagnosed with cancer, my life was just routine and busy, and I was happy with it, and things went along, and I really didn't spend a lot of time thinking about these questions. And now, having been out now for about 4 years, I think about it a lot. I think of a certain part of before being diagnosed with cancer. I can say most of my day, I felt like most of my day was spent with either the list of things that had to get done, between getting kids to school and laundry and getting them new shoes because they outgrew their shoes and all that sort of stuff, and doing things for a later day, like whether it was writing grants or papers or doing it. So little of my day was spent just appreciating today.
Mm-hmm.
And I feel like I do that a lot more.
Mm-hmm.
I definitely tell my family members more often how appreciative I am of them, because that was a big issue in getting through all of this. I have a really good friend who went with me to every chemo appointment because she doesn't work on Tuesdays. And I would be at the hospital from 9 in the morning till 7 in the evening because you get labs done, you see the doctor, they have to mix up you're there all day. And she stayed all day. And I try to remind myself of those things and remind my friends and family of those things as well.
I love that because I have always looked at my own health challenges as sort of a gift in many ways. You have the chance to kind of reevaluate and think about the bigger picture and what does this all mean and what do I actually want to contribute, right?
Mhm.
So,
Right.
Dr. Martinez, we are so, Deanna, grateful that we've been able to work with you on this awesome package. And I just wanted to sort of showcase, we have a wonderful journal. We have these great socks. Deanna was really passionate about the need for moderate exercise when you're going through treatment, and layering that with support from a friend, going walking with a friend, so you can kind of stay in a good mindset and do exercise at the same time. We have great lotion. We have the mouth rinse that Deanna talked about, which I think is so important for keeping your mouth healthy. And then caffeine, I know, was a big part of your your day when you got so tired with treatment. And then a nail clipper, interestingly, where it's really important to have a brand new one, so you're not sharing it and risking the infection. So Deanna, just wonderful to have you on today. Thank you so much. And I think it would make sense. I mean, I think this medical marijuana topic is so interesting that we should follow up and do something else there. It'd be a lot of fun.
It's an important topic. It's something that people should know about. And the data is out there. It just hasn't been presented in a way that's easy to access.
Yeah. Wonderful. All right. Thank you so much.
And absolutely, anytime.
One final note on Deanna's journal that she wrote for our gift box. This journal has so much great information in it. Deanna has a wonderful perspective. She has a lot of practical advice. We really didn't want to only make it a part of the package. We wanted to put it out there for anyone who could find it useful. So it's free. It's on our website. It's in PDF form. It's at restandheal.com/resources. Please feel free to download it, share it with family and friends, anyone that could find it useful. Thank you.